Welcome everyone to our course. Today we're going to discuss how to pass the exam for licensing in pharmacy in Saudi Arabia. We need to know that the exam is not limited to only informations like pharmacology, pharmaceuticals, basics knowledge. No, it also prepare you to be an employee in Saudi Arabia. So, with the fundamental knowledge and principles of pharmacy, we will discuss also another informations like how to behave in certain situations, how, how to manage your pharmacy, how to deal with your colleagues. All of that will be a part of your exam. As you know, as a pharmacist, you have to deliver a quality work. You have to be successful not only in knowledge, but also in business. How to be useful and helpful in your community. So the exam is consisted of all parts of this knowledge, what we call the pharma knowledge, and the second part is called the non-pharma informations. So let's dive into it, and together we will know how and where to find the useful informations that will help us to pass the pharmacist licensing exam test. Okay, let's begin first by knowing the exam. The exam consists of 210 questions. The full score is 800. That means the question will be 4 marks. But if we multiply 4 by 210, we will get 840. But why the full score is 800? That's because 10 questions are experimental. There are no marks for these questions. Why the Prometric is putting experimental questions? That's as we know, the Prometric is trying to update the informations and the questions that the exam to be a challenge. If the Prometric is repeating the same questions, that means after a while, the people or the participants will be familiar with the questions that are provided by the Prometric. So there will be no challenge in the exam and everybody will pass the exam easily. But in our situation, that's not the case. The Prometric is trying to update, to renew, and to give the participants a challenge to pass their tests. So the experimental questions are provided to know how many of the participants will be able to answer those questions. If too many people or too many participants are answering these questions, that means in the next exam, those experimental questions will be added to the section of the basic questions. So the Prometric is trying to find out, are those questions participants able to answer them? If they are not complicated and participants answers them, then they will be included in the basic questions for the participants are examining in the next period of time. Okay, let's move to the time of the exam. The time of the exam is 4 hours divided into two parts with a 15 minutes break between the two parts. The most important part of the exam is the exam time because a lot of people are prepared and well reading, but the time is making them unable to succeed in the exam, which I can call it here the silent killer. Even if you was smart, the time will be a real challenge for you. Because if we do the calculations, the question must be answered within 1 minute and 8 seconds. If you divide it 4 hours by the 210 questions, that will give you have 1 minute and 8 seconds to pass the exam. The problem here is, okay, someone may say, I can leave the experimental questions. There is no marks, so why I should answer them? Unfortunately, the experimental questions cannot be distinguished from the basic questions. You can't know that if this question is experimental or it's basic. So you have to answer it anyway without knowing is it experimental or not. Okay, let's move to the question method. The question method is choose the correct answer from 4 options. We know that type of questions. We all familiar with this type of questions at the university. which is called MCQ questions. Exam sections and grades are distributed approximately as follows. This percentage can be low or can be more according to the questions that you will get from the Prometric database. So the pharma may be 35% as mentioned here, or it may be 40%, or it may be 25 or 30%. So as I said, it's approximately percentage. Pharmaceuticals, which include QC, quality assurance, pharmaceutical technology, that is also 35%, can be more, can be less. We have the basics, which are the basics knowledge like biochemistry, physiology. Those are 15% from the exam. The non-pharma section, which is also an important section in the exam. As we mentioned previously, that to succeed in the exam, it will require more than the pharma knowledge that you know. You have to understand the rules, the regulations, the laws, the ethics of Saudi Arabia. So the non-pharma part is 15% of the exam. Okay, you must pass each section separately. Failure in any section means you will fail in the whole exam. So you can't say, okay, I'm not gonna study the basics, it's only 15%. So I will focus on pharma and pharmaceuticals. Unfortunately, you have to pass in all the four sections to pass the exam. As we can see here, this is a picture of a result from a participant that failed in the exam. Even he is in the basic biomedical science, he have a score above the average in the clinical science also, in the pharmaceutical science. But his problem was the social, behavioral, and administrative science, which is called non-pharma knowledge. So, in order to pass the exam, you must succeed in all the four sections of the exam, as we can see here in this figure. Okay, let's now talk briefly about the parts of the exam. We will start with the basics science. At first, we have biochemistry, which include the knowledge of polysaccharides, the carbohydrate, the fats, the Krebs cycle. All of that is can be a questions that you will find in your exam. Throughout the course, we will know what are the topics that you can focus on in biochemistry and the sources that are reliable to read from. The second part from the basics science is the pharmacodynamics. The pharmacodynamics are defined by simply the effect of the drug on the body. Here we can mention the terms like potency, efficacy, receptors. Also, you have to know competitive blockers, non-competitive blockers. All of these are the basics of the pharmacodynamics science. Also, we have pharmacokinetics, which is simply defined by the effect of the body on the drug. By that we mean the immune system, the absorption, distribution, excretion, metabolism. All of those parts questions will be found in the exam. Phytotherapy or pharmacognosy. As we know, the herbal products are the source of a lot of drugs that is known today, or the precursors of the drugs. So you have to know there are some plants, some extracts which have pharmacological actions and used in certain conditions. So you must be familiar also with this part. Also, we have genomics. In genomics, we have to know the definition of gene, the definition of mutations, and the types of mutation. Is it silence or not? Also, there are some genes related to specific medicines. We have to know them all. So, before giving a certain medicine, you have to perform a gene screening at a particular patient to find out if they have that gene or not. All of that we can know through our course. Okay. Also, we have the microbiology. We have to know the gram-positive bacteria, the gram-negative bacteria. We have to know the difference between the bacterial cell, the virus, the human cell, and the fungi cell. We have to know an example for each type of bacteria. We have also immunology, which is considered the biggest part in basics science. Why? Because it includes vaccines. As you know, a lot of people are coming to Saudi Arabia as visitors or people to perform Hajj or Umrah. So the vaccine is getting more attention in Saudi Arabia. So we must know the vaccines, those are given to Haji, the vaccines who are given to children, and the vaccines which are given in certain situations. Also, we have the immunoglobulins and antigen, which causes the hypersensitivity reactions or defending the body from external organisms or toxins. Also, we have genetically modified drugs. All of these topics are related to immunology. So, immunology is the biggest part in the basic science. I can say you it may in the exam it may participate in more than 5 questions. 5 questions, if you multiply by 4, that means 20 marks. So we must not underestimate this topic and also all of the other topics. But immunology is the biggest part in the basic science. Physiology, those are related to hormones that are secreted from the endocrines. We have to know the function of all of the hormones produced by the human being. Also, we must know the pH of the body in different parts, the pH of the blood, the pH of the stomach, intestine, and all the parts of the body. Those are the most important topics related to the basic science. Throughout the course, we will know from where we can read and the sources of information which are updated and corrected. Okay, let's move to the biggest part and the most difficult part of the exam. It's the clinical pharmacology, which we know from our study in the university that is the most difficult subject in pharma. And in the exam, at these sections, the challenge also is found because in this part, the questions is not directly asked. You have to know the details of each section of each drug to be able to answer the cases that you will find in the exam correctly. Let's start with the biggest part, which is the cardiovascular system, which include the hypertension and the heart failure and dyslipidemia. All of these topics we know can be treated with different drugs and different classes of drugs with different interaction, with different side effects. So you must know them all. The topic of hypertension is considered the major topic that you will find in the exam, and not less than 10 questions will be related to hypertension. So this part is considered very, very important to be professional in dealing with it in the exam. The second part that is came right after the cardiovascular system is the endocrine. Why is that? Because endocrine includes the topic of diabetes. We know type 1 diabetes and type 2 diabetes. Those are the diseases that a lot of patients are suffering from. So you must be professional in dealing with diabetes and hypertension. You must know all the drugs, all the classes, the interactions, the contraindications for those drugs, along with other smaller topics like thyroid and hyperthyroidism and thyrotoxicosis and contraceptives. Okay, the third one is the central nervous system, the depression, the bipolar disease, multiple sclerosis. We can consider this to be the third topic in terms of the number of questions that you will find in the exam. Autonomic nervous system. The autonomic nervous system is, as you know, you can find it in each part of those systems that we mentioned before. You can find it in the cardiovascular system as beta blockers, alpha blockers. You can find it in the respiratory system. You can find it in the GIT. So it is better to study the autonomic nervous system not separately as autonomic nervous system. You can study it when you are studying the cardiovascular system and other topics. Just focus and differentiate between beta blockers, alpha blockers, where the receptor is located and what it does when it's triggered and what it does when it's blocked. The respiratory system is also important. You have to focus on topics like asthma, a lot of questions, and definitely you will be asked about asthma in your exam. Antibiotics. Antibiotics, we can say it is the fourth part. If we say the cardiovascular is the first, endocrine is the second, CNS is the third, antibiotics are the fourth part in terms of number of questions that you will find in the exam. So it's required a focus on the generations of the antibiotic. You have to differentiate between them. Also, the classes and antibiotics are working at different sides of the cell. You have to know each antibiotic and how it works. And the questions in the section of antibiotics in the exam are came as cases. You can be given a lab results with elevated white blood cells count and another symptoms in the case, and you have to find and diagnose the, the type of bacteria that is infecting the body and the suitable antibiotic for killing that bacteria. Okay, the GIT is a smaller part, but we need to focus on the ulcer and H. pylori and the GERD condition. Hematology. Also, we have to focus on this part. It includes strokes and thrombosis. We have to know how to manage and prevent the formation of clots in the body. Here, we have to understand the clotting cascade and the medications that are working in different steps in the clotting cascades, like warfarin, like Glixane, and other medications. Toxicology. We have to know the symptoms of some metallic and poisonous elements to human beings, like mercury, like cyanide, like lead. And also, we have to know the antidotes for the drugs. In case of overdose, we have to know the antidote for that certain drug. Scores. Scores are very important to people who are specialized in clinical pharmacy. As we know, we have Framingham risk score, which give us a number that can be used to predict a certain event. Also, it can be used to calculate a number that help us to choose a certain medicine. During our study to scores, we will know scores that are related to liver disease, scores that are related to heart disease. Chemotherapy. The most important thing to know about chemotherapy is the side effect of the drug. The questions are focusing on the side effect of each chemotherapy and the mechanism of action of each anti-neoplastic agent. You have to know which phase of cell mitosis the drug is working on. By that, we got a briefing about the clinical pharmacology section. Okay, let's move to the next part, the pharmaceutical science. At first, we have to know the fundamentals of quality control and quality assurance. We know that quality assurance include several topics like GMB and storage practice and distribution practice. We must be familiar with those topics. In the QC section, we have to know the QC tests that are performed that to make sure the product is within the recommended quality. As we know, the QC is a department in each facility that is producing drugs. And we know there are certain tests for each dosage form. We have to know those tests and how they are performed. Also, we must know the pharmacopoeia and the chapters in pharmacopoeia, which is containing the sterilization, which chapter of pharmacopoeia contain the hazardous materials. All of that will be clear when we are studying our course and we will know the sources of information to study this. Let's talk about the pharmaceutics, and here we mean the dosage forms and the excipients. You have to know the type of tablets. You have to know the type of capsules, hard gelatin, soft gelatin. You also have to know each excipient and the function of each excipient, the diluents, the fillers, the coating materials, and their types. Medicinal chemistry. The exam is also containing instructions. We know a lot of people hate this part, but we have to know where to get the informations that we will find in the exam. There are certain sheets and sources for structures that are continuously showing in the Prometric exam. We know that you can't return to a big text to study the medicinal chemistry. So there are certain sheets that people and participants agreed on that the structures within this sheet are repeatedly showing in the exam. So together we will know how to study this part and how to pass it in the exam. In the exam, there will be no less than 20 structures that will be showing in, in your exam. So special attention must be paid for this part. The calculations, which is a bigger part and we can call it a very difficult part. Why? Because it is the most time consuming part in the exam. So all participants and all teachers are recommending that the calculation must be solved at the last part of the exam. After you have finished the questions that are related to all other topics, then you can start solving the calculations and the mathematical problems. Because the mathematical and the calculation problems are divided into two ways that can be shown in the exam. Uh, the first is easy and It's more logically than it's mathematical. So you can solve it without even thinking twice. But the other part is very complicated and long. So if you try to solve all the calculations before you solved the other parts of the exam, the time will be consumed and you may lose your time and you can find yourself that you have not answered maybe 20 other questions that may be easy and you know their answers already. So don't waste your time in the calculation part. Okay, now to the last part of the exam, which is the non-pharma or the administrative science. First of all, we have to know how to study design and the type of studies. As we know, we have a retrospective study and we have a prospective study. All of those studies have, have been designed to give a certain outcome or to give an indicator to something. So we can't know through the course the use of every study design and the order of study designs from stronger to the weakest. Also, we have to know some economics, which is considered the benefit that the patient gets regarding the money that he pays. Okay, also we have types of costs. For example, we have direct costs, which are the expenses of the patient in the hospital. We have a type of cost which is called indirect cost. For example, we can say the family of the patients are traveling from one state to another to see the patient. So this cost is called indirect cost, which is not related to the hospitalization or the drugs that the patients are taking. All of this is made to ensure the quality of service that are provided to the patient and to feel sympathy and empathy to the patient. Okay, we have also adverse effects types, which is seen as a pharma topic, but I prefer to study it with the non-pharma topic. For example, we have adverse effects that is related to higher doses of the drug. We have adverse effects which is related to genetic reasons that are related to the patient. So adverse effects have several types that we will know during the course. We have the ethics in Saudi Arabia. Those are, for example, treating all the patients equally regarding their political status or their financial status. Also, we have laws and regulations. The difference between ethics and laws are ethics are you will not be punished if you stick to them or not. But laws, you have to stick to them or there will be a punishment if you don't. Regulations, we have to know the facilities in Saudi Arabia and their functions. Like we have the Ministry of Health, which is responsible for setting the rules, which are responsible for inspection of pharmaceutical facilities. Also, we have the SFDA or the Saudi Food and Drug Agency, which is responsible for registrations of new drugs and responsible for counting the stock that to prevent any stockouts that may happen and leading to medical problems to the patients. Levels of care. Also, we have this topic which consists of at first to understand this, the patient can be at the first of when he feel something is not good, he will go to the general doctor. If the general doctor couldn't deal or couldn't solve the problem, he will transfer the patient to a specialist. And if the specialist could not solve the problem, he may hospitalize the patient or transfer him to consultant. So all of these are levels of care we will know throughout the course. The management, as you know, as a pharmacist, you have to know how to manage your pharmacy, how to manage your staff if you are in a manager position. Communication, we have to know the communication barriers. We have to know how to conduct a good and useful communication with the patient. The marketing, we know it's a very important topic that we can be withstand the competition in the Saudi market. We have to know the principles of marketing. Also, we will discuss this part during the course. We have diets. For example, some patients are required to follow specific diet to enhance their health. If you want to lose fat, you can go on a keto diet, which is free from carbohydrates and fats. There are another diets that are recommended for hypertension patients. There are specific diets recommended for diabetic patients. Medication errors also are classified to help in reporting the incidents. Some errors are caused by the doctor, which is called prescription error. The doctor wrote a wrong medicine. The error may result from the pharmacist, which is called dispensing error. The pharmacist dispensed a wrong medicine, and many other types of errors. We can know them, so it helps in reporting the incidents. Sources of informations like textbooks, like scientific papers, all of them are classified, and there are some sources for specific type of informations. Some sources are specific to pregnancy. Some sources are specific to kidney disease. Some sources are specific to vaccines and preventable disease. All of them will be clear throughout the course. And now, this is the introduction lecture for our course. I hope that it's being helpful to all pharmacists, those are going through or preparing to the exam. And working in Saudi Arabia is very good, and the work environment is very healthy, and you can grow and you can learn a lot of new things. So if you find this useful, do not hesitate to call us or participate for further informations and to complete the course. So this will be the end of our first lecture. I hope that you enjoyed it, and see you soon.